Good morning and good afternoon, depending on where you are, and welcome to the Systems for Action webinar on how to achieve, it really focuses on how to achieve alignment, collaboration, and synergy across some very diverse systems. And this one, today, we're addressing the impact of system alignment efforts in law enforcement. So I want to just do a little bit of housekeeping, let you know that by the end of the week, you will get an email with a link to the recording and the slides. So you will be able to see the copies of the slides that are being used today and the questions and the information about the speakers. And also all of the recordings of this webinar, previous webinars are available on the same website. So if you have anything else that you might be interested in, please access the website. So I'm going to start by just introducing briefly the panel that is going to be speaking about the work that they've been doing on this system alignment effort in law enforcement. And I'm not going to read their whole bio for each of them because it would take about an hour, I think. But I'll briefly introduce them and you'll be able to look at their bios. Then we have a few questions that we've put together that they will respond to, and they will do a brief introduction of the projects that they've been working on. And after that, we will have an opportunity to have some open question and answer discussion. So first, let me go ahead and introduce the presenters, and we'll start from there. So Bill Riley is a professor in the science of healthcare delivery in the College of Health Solutions at Arizona State University. George Naufal is an associate research scientist at Public Policy Research Institute at Texas A&M University, and he's a research fellow at the IZA Institute of Labor, Economics, and Economic Research Forum. Emily Naiser is at Texas A&M, and she has done a lot of research work in public health and the care needs of children with disabilities and in adolescence health. Daniel O'Connell is at the University of Delaware, where he's a senior scientist and assistant professor in the Department of Criminal Justice. Patricia Becker is an assistant professor of criminology at the College of New Jersey. And I think we'll start with having the presentation about the work that's already being done. So, Bill, do you want to start?
Linda, thank you very much. Good morning, everyone. It's delightful to be here with you. We currently have 4 projects underway with respect to systems alignment regarding justice involved. 2 of them are RWJF funded, and 2 of them are from other funding sources, but they all address alignment mechanisms. They all address criminal justice, and they all address alignment mechanisms. So just quickly, one project is a 911 co-location with behavioral health in the emergency 911 system. Phoenix gets about over 2 million calls per year, and a large portion of those are behavioral health related, probably 10 to 15%. Other projects are medication assisted treatment program in the Phoenix jail, which is the 5th biggest jail in the country, and then the emergency medical response system, and then finally a behavioral health and primary care integration for justice involved persons on the state Medicaid program. So again, these populations they're each separate, but there's a lot of overlap between them, and all 4 of them involve familiar faces with the specific governmental agency that they're involved with. Thank you, Linda.
Okay, and Daniel, do you want to talk about your projects?
Sorry, I was muted. Yeah, we're going to focus on the one that we did as part of Systems for Action, and that was the Culture of Health project in the probation department at the University of Delaware. Trish was the lead researcher on that. She was writing her dissertation and working for us down here So I'm going to let her talk because she handled the day-to-day. So Trish, do you want to go ahead and?
Yeah, sure. So for our RWJ funded project, it was a 2-year pilot study that really investigated the process and impact of implementing a multi-agency culture of health team in the Delaware Department of Probation. The project implemented a local change team titled the Delaware Culture of Health Team to focus the efforts of multiple agencies to improve the alignment, collaboration, and synergy of health and other social service delivery to these underserved populations, individuals that are on probation. So the local change team was represented by Delaware Department of Correction, Health and Social Services, Housing, Labor, and Education, the Christiana Care Health System, Brandywine Counseling, Delaware Department of Health, and other community-based treatment and service providers. So in total, we randomized 400 individuals that were on probation in Delaware during 2016 to 2018 to determine the effectiveness of placing a health navigator in the probation offices. And the health navigator was really, their main job was to link individuals to primary care physicians and to any other sort of healthcare treatment that they were interested in. So that's really the gist of our project.
Okay, thanks. I think you'll find that all of these are very interesting, and the questions are going to give us some, will really give us some more insight, and then you'll be able to ask some questions. So what we'd like to do is have someone from each of the teams answer the question that we have posed. So for the first question, what have been your lessons learned in your cross-sector alignment criminal justice programs? And how can the lessons you've learned along the way be applied in practice? Anybody ready to go first?
I'm happy to.
Sure.
This is a really good question. And again, one of the reasons I mentioned 4 different projects that we're working on that involve systems alignment, I've got an N of 4 to refer to. And the biggest lesson for our teams is how easy it is to accomplish intervention when the right partners are involved. It's just phenomenal how flawless it goes, how problems get resolved, and progress is made. So on the other side of that coin is also how hard it is when there's not support by the partners, and problems that can be solved don't get solved. And as outside partners, we're limited in terms of the influence that we can have with, especially with our governmental partners or with our other partners who are serving these populations. They're all very, very committed, but they all have different cultures and leadership in terms of how they respond.
Okay.
So this is George Naufal and Emily Naiser. We're from Texas A&M. I'm going to have Emily kind of summarize our project, and then I'll go back and answer the first question that was asked.
Okay.
So the program that we're working on is that we're evaluating the Transformative Justice Network here in Williamson County, Texas. We have some partners over at the Harvard Access to Justice Lab and the University of Texas Health Science Center, all being a part of our evaluation alongside with us. And really, we're focusing on the emerging adult population. In Texas, one of the statistics that we like to tout, because it really kind of paints the whole story, is that 11% of Texas's population is between the ages of 17 to 24, but they account for 29% of the arrests here in Texas. And a lot of times we see that they have very specific health needs like substance abuse and co-occurring disorders, other traumas, and that these underlying factors as to why they're in the criminal justice system to begin with are not being addressed. So the program that we evaluated is looking at ways that they can address some of these things. They're providing intensive case management to participants, developing care plans with like input from multiple people, on the team and multidisciplinary team, giving them services that are related to the community. And if possible, if they complete the entire program, they also get an expungement of their charge. We are looking at it from, is the program effective? Looking at different outcomes related to recidivism and health outcomes, but then also kind of considering their employment changes or educational attainment or housing security throughout the program. And then we're also trying to understand the why, like what is driving those outcomes. And that's through talking to the participants, talking to all the key programmatic stakeholders that have been involved in setting this up. We started in 2019, we're wrapping it up now in 2022, and we're kind of working towards the final analysis and results of the project.
And I'm going to jump in and add to what Bill was saying. What we learned really, some of the lessons is that you need support, and it's hard, but also you need this kind of almost full ownership of the program from, the stakeholder side. Ideally, you have one or two champions who can help you overcome obstacles, kind of guide, all of the program forward and push it forward. We also, another lesson that we learned is that people are as important as services. We talk a lot about providing services for emerging adults, but also building trust with the team, building connection with those involved. A lot of the success and change from participants really viewpoints came from having a very supportive team and building that trust, and that takes time. And initially, you could see that change over time. And something else that I just want to add is that outcomes are often cross-sector, across different fields. It's not just criminal justice. You think about short-term, long-term outcomes. You think about other sectors, social, community, family, and so that's something that often we want to suggest researchers to keep that in mind.
Okay,
and then I can jump in and finish it off. So along with Bill and George, I would say that here at Delaware, we experienced the same exact lessons. One other thing that I think it was really important that we didn't anticipate kind of occurring is the fact that individuals on probation did not feel comfortable partaking in the study at probation. So initially we thought meeting them at probation would be useful because they were already there to report with their officer, and then this way they don't have to go out of their way to go to a specific center or anything like that. So we thought it would be beneficial or helpful to be meeting them there, but we didn't anticipate that these individuals are maybe having to report once a week, and oftentimes they're sitting in the waiting room and not knowing when their officer is going to call them back. So they're already frustrated with having to go there and not sort of knowing when they're going to be called back and not wanting to miss their appointment. So they really weren't interested in talking with us or partaking in the study. It took a lot of finagling. I was one of the health navigators along with Judy Buchanan. So it took a lot of us like meeting them where they are, going out in the waiting room and working with the officers, that the officers would come and grab them. But many of the individuals expressed that if we would have done it at a community center, they would have been much more willing and interested in partaking, because not only would the services be they would be able to reach, but they could also bring their family with them, right? They could bring their spouse or their children to get some services and information as well. So that's one huge lesson that we learned from this project, is us thinking it was a smart idea to start at probation, clearly wasn't. So we probably should have spoke with individuals prior to then jumping in and rolling it out at probation.
Great, thanks. I think those responses are really helpful. And so we'll move on to the next question. As researchers, what has your experience been working with the community, and how do they perceive criminal justice and policing policies and interventions in your community? How do you navigate these often fraught relationships and negative perceptions that might exist?
I'll jump in unless Daniel, were you ready to go? Go ahead.
I was going to go, but if you want to roll, go ahead.
No,
All
you
right.
do it.
So I don't know if people know this, but there has been some issues with communities and law enforcement and criminal justice agencies over the past several years. Now, we were in the field in 2017, 2018. And actually this stuff was all there, just not in the news as much. And Dr. Becker kind of talked a little bit about some of the stuff we got. Like, these guys didn't want to be at probation. So we come in and we're like, hey, have you thought about your health? And they're like, what? And so, but the way you deal with that though is over time and building bridges. And Trish and Judy Buchanan being up in probation, they were camped out up there, and so people got used to seeing them around, got to know them, and got to know what they were doing, and then the word of mouth started to spread. Hey, these people were able to help me with this, that, or the other. And I did get something out of it. And by the way, I didn't miss my appointment, and they're really not talking to our POs. They're just here representing these other agencies. And so that part. And I think in a way it speaks to a broader issue and some of the projects that we're working on now is more police centered as some of these agencies start to change the focus of what they're doing. Is going to allow those bridges to communities to be built. When all you're doing is going down to a neighborhood and arresting people, you're going to get a certain type of reputation. When people start learning that there's more to it and more involved, that'll happen. And the thing is, this is going to take forever. This is incremental steps. With like the projects that Bill's doing, that Emily and George's are doing, all of these things, are these little kind of stones on the pile that is slowly going to start to move the needle, but it ain't going to happen in a week. All right, I'm going to shut up because I'll talk all day. So.
Okay, either the Texas team or Arizona.
Go ahead, Emily.
Sure. Our experience with the community has been great. We found that even though they may not agree on should criminal justice be stricter or more rehabilitative, in general, there was just kind of this opinion that whatever we're doing is not working. So how can we change it? So they have been very open to us studying the new approaches in this community, plus some of the other communities that we've been doing research in. I think for us, one of the things that we felt was really helpful was we've been pretty ingrained with the program since the very beginning and all of the stakeholders. We went down to talk to the stakeholders, talk to them about the research early on, try to be available to answer any questions they might have come up with related to, will this be appropriate for defendants, and what does this look like, and how can we protect their rights and things like that. From the very, very beginning. And we tried not to mess with their program, except when we really had to, right? They have to use a consent form and they have to do these certain things. And just tried to really say, this is yours and we're trying to evaluate it, but we want to be part of kind of a collaborative process. And that seemed to go over really well. We feel very ingrained with our community.
Great. Okay, Bill?
What I read into this question were that we deal with a number of communities, the community of providers, the community of police, the community of EMS, as well as the recipients. And all of those communities, the provider and the police and the fire and so forth, are tremendously committed. And it boggles my mind. I'm not an expert in this area the way Daniel and the others are, but the police department wanted us to do several studies on what are the police, the frontline officers' perceptions, what do they want for their community and for their they've got a word for it, I can't remember, their clients, the people that they interact with. They really understand the challenges of behavioral health. They just don't have the time to deal with it. They're not trained to deal with it. They'd rather have behavioral health. And I was just so impressed at their commitment and their insights. And it's got to be one of the toughest jobs in the world. So getting that eye opener. The other part of it is, especially, and I know the Robert Wood Johnson Foundation has been leaders in this for decades, and it's another area where I've been in this area for decades, and I finally have had the experiences. Like, for example, we're leading the Arizona Medicaid program has a $300 million program to provide incentives to the providers to meet the HEDIS metrics for the underserved and for the justice involved and so forth. And like, for example, for kids who are on antipsychotic medications, the standard is, the evidence is they have to have annual screening for metabolic screening. And in Arizona, which is probably about typical for the nation, only 40% of the kids are getting the metabolic screening. Well, the providers want to do the right thing. And so as we've been working with the providers, the system is stacked against them so much. They are experts at dealing with the patient when they're in their room. But if the patient or the family or whatever, and the system misalignment that we found as we did cause and effect analysis and so forth, something so simple as at least 40% of the patients and the providers, the patients don't know who their provider is. The provider doesn't know who their patient base is. And because we have 7 different health plans in Arizona, they all serve Medicaid. They all have a different attribution system. They all report their panels differently to the providers. And they're all 3, 4, 5 months late, well, most of them, in getting the patient panel information to the physicians in the hospitals. Well, no wonder they can't meet these metrics. And then, and even though they have the incentive to, and I really like the way Arizona set this up, is that they get positive incentives for treating a population of patients. They don't know how to treat a population of patients. They're not given the time. And so we give them a lot of hand-holding in TLC. We meet with probably about 80 or so organizations at least every week and in Arizona to help them develop the processes and the QI maturity so that they can treat their population of patients beyond just the patients who are coming into their clinics. And it's really been gratifying to see how committed they are. But again, they don't have the talent, they don't know how to do it, and they're already overloaded in terms of seeing their patients. And this is one more thing for them to do. So that's been the experience working with communities. Thank you.
Okay, great. Thanks. Well, the next question is about the cyclical interest in criminal justice mental health collaboration program. What recommendations do you all have to support sustainability and continued funding of these programs?
Well, we can go in reverse order. I'll back to the 911. We provided the evidence. We were and this is a RWJF funded project. We brought together the crisis response network with the police department in the 911 call system. Again, the police department is just so far out front in terms of providing enlightened leadership. And so our findings showed that having a 911 behavioral health therapist located, having a behavioral health therapist located in the 911, and it wasn't even full time, but that increased the use of the crisis line, where the dispatchers transferred the call right to the crisis line. And that increased the use of the crisis line like 300 or 400%, and it decreased the police dispatches by about 200%. It was and the city council approved a permanent position for that based on this demonstration project that we did. So that's the ultimate way to get permanent funding, is to show that these interventions work and that they're cost effective, and it really brought together all the components, relevant components for the multi-sector alignment. Thank you.
Okay. The Texas team, how about you?
All right, so I'll also continue what Bill basically mentioned. I think from our experience, the collaboration between the research team and those involved in the program is a very important component to find and document the impact, and that impact could be documented in different ways, but one of them would be different outcomes, but also the cost effectiveness of the program. Another thing that we also looked at is that at the end of the day, some of the discussions we've had with those involved, by the time you get to the criminal justice, by the time you end up at that level, it's almost too late, in the sense that so much has happened before to get to those to that outcome. Meaning, there's so many underlying factors that could have been addressed before, perhaps at a much less in terms of intensity, the intervention intensity. So some of the things, besides having evidence-based policy, but also realizing that by the time you get to the criminal justice system, it's almost too late. So you want to work, try to identify those factors right at the beginning, and to be able to do so, you have to have a wide a team that involves community, involves other stakeholders, where the responsibility doesn't fall just on the criminal justice unit, but also on everyone else. Hopefully, aggregating those resources, having people involved from the get-go, will increase the effectiveness of those interventions, have them to be more cost-effective, and then basically avoid having those long-term impacts that are seen once you reach the criminal justice. And that's basically our suggestion and recommendation, along with obviously the policy-based approach.
Okay, great. And how about Delaware?
I'll start, and Trish can add if she wants. I will echo the results lead to sustainability. We were not able to sustain the culture of health in Delaware probation, partly because we got positive results in the pilot. They weren't outstanding results, but we got a moderate effect size difference between the two groups, which to academics is like, yeah. But what the DOC people took away is, these guys really don't want to do it, and our probation officers don't want to do it. So we really couldn't get the buy-in. That, coupled with a couple of the key people moving on, we had some champions for the program that were involved and really believed in what we were doing. They then moved on, and kind of DOC drifted into some other kind of approaches, and it just kind of fell out of favor. So we were not able to sustain that. Now we are doing some system alignment. We're not currently involved in RWJ with this, although maybe we should consider it, where we're working with police and mental health. And it is the same type of things. Some of this is just anecdotal at this point, but with police showing up at residences, dozens of times in a month, we've got these stories where they get somebody like linked to care, and then those calls just go away. That's how the chief in one of our police departments got completely bought in, because he saw it was freeing his officers up to do other things. And both groups have kind of said this. The officers are willing, but they really don't have the talent or the bandwidth. Their expertise is in other kind of things, which is why one of our county departments that we're working with, they got BJA funds and hired in-house clinicians, both for substance use and mental health, that are embedded in these police units. So the officers, because we've learned it's not enough. You can't necessarily send a mental health or a substance abuse person to these doors and have them knock on the doors by themselves, because things can get weird. So having an officer around is useful, because those officers have a skill set that can be very useful in certain situations. But they're not mentally health trained, and they're not substance abuse trained. So these partnerships are important, and we've had some early on luck in some of these things. So it's getting that initial buy-in, and then demonstrating early results, even anecdotal ones, and then of course leading to the more formal results that you can get written into state budgets and things like that. And that's where the sustainability is going to come.
And then just to add to that, I think the training among police officers or correctional officers is really important, but also we have to think about training among health providers, healthcare providers in particular. Many individuals on probation spoke to me about being nervous to see a healthcare provider and disclosing that they have a criminal history, that they've been incarcerated, that they're on probation. And we know that those experiences cause unique needs for these individuals. So they should be disclosing it, right? Because their healthcare provider should be aware, because there may be specific things or treatments that they may need additional of or different services. And then I had many conversations. I went to a conference a couple of years back from people that are doctors and said that never had a criminal justice course throughout their training, throughout their educational experience, which I think is so important too, because, you know, if we're living in the United States where we're locking up majority of our people, of our citizens, right, and majority of those that are incarcerated do get released at some point. So we have this huge underserved population where the healthcare providers, or we're telling them to go to healthcare providers, but are we really sure that the healthcare providers are adequately trained for the individuals that we're sending them to? So I know when I was the health navigator, that's something I had to grapple with, is I'm pushing individuals to seek medical services that I'm telling them they should do and explaining that process. But then in the back of my mind, I'm thinking, are these medical providers really equipped to handle individuals that are dealing with criminal justice, whether it being incarcerated or on probation, because we know that causes unique needs. So I think along with training of officers, we also need to think about how we can expand training for individuals that are in our healthcare systems.
Okay, great. Yeah, and some really, I think, important findings and some recommendations that perhaps nobody would have necessarily expected about training and the importance of looking at what training people in various parts of the system have received. Okay, so let's see, we have a couple of questions already in the Q&A. So I think we should go to those. The first one is actually, how do you identify the right partners and how do you make the decision of who needs to be at the table?
I can lead off on that. Starting from the middle, or reverse order again. We'll ping pong. For us, we had some early conversations with the folks in probation that were bought in, and we envisioned health writ large because it was the culture of health. So we wanted to link people to healthcare, but we very quickly realized that okay, you can't get proper health if you don't have proper housing, right? You can't even get to an appointment if you don't have transportation. And it just kind of started growing. Well, does health include mental health? Does health include substance abuse? So it kept kind of reaching out to all these different groups. And so it was part of, okay, what is it we're trying to do? And then part of it was kind of, the usual suspects. Delaware is kind of a small state. And we have a circle of folks that we work with and know about, and they know about us. So when we started thinking about this, we made some phone calls. Hey, we got this thing. Would you be in? Yeah, we'll come to a meeting. They come to a meeting, and then maybe they recommend somebody. So there was some snowballing involved. So we started with a core group. It slowly grew based on need, the community of practice folks that are just kind of around doing behavioral health work. And then, over the course of time, some of them became really bought in partners. Some of them would show up to the meeting and we could, reach out to them if we needed. But that core group kind of got built by doing that. So that's
Okay.
That really is an excellent question and nice response, Daniel. My reaction to that is, at least our experience is, you don't find the right partners, you develop them. And there are certain things that we do that make it a good partnership, such as we always start the budget with our partners. What do you need to do this? You tell us what you need, and then we'll make it work on our end. And I know elitist universities where they expect their partners to do everything for free, and the researchers keep all the funding, which is, how does that develop a good partnership? But in any event, and then even in that context, we have partners who either they fizzle out or somebody gets promoted or retires and the champion is gone. But we've got probably 20 really, really tight partners that we work with in Arizona. And that doesn't happen overnight, but it's to the point where I'm sure all of you do this too. I can pick up a phone and talk with somebody, and within 2 minutes decide if we're going to proceed with something or not. And if they say yes, we're going to do it, we know it's going to get done. So again, good question, but a good partnership is worth its weight in gold.
Yes.
Okay.
So I'm gonna,
George,
yeah, from our experience, it matches what Daniel and Bill said. With the Public Policy Research Institute has been working in criminal justice and other fields over the last, actually next year will be our 40th year. So we built a lot of relationships in Texas, as Bill mentioned, that do not happen overnight. Some of those champions do leave and retire and change jobs and move on, but we built relationships also with departments and units and different teams that we were able to kind of keep some of those relationships for more than 20 years in some instances. Typically you meet with a partner who then say, as Daniel mentioned, mentions that another unit needs to be involved, another department needs to be involved, and typically they do those introductions.
Yep.
And then that snowballs into building a team where often everybody needs to be on the same board. So we've been in projects where everybody was on the same page, things moved unbelievably efficient, and we've been on projects launched, paused, stopped, and died simply because one stakeholder just was not on the same page and literally basically stopped the whole project or affected it in a way that the power and then the intervention became almost just not usable at all. So that's what Daniel and Bill said. Basically, we have the same experience.
Okay, great. Well, we have another question, and before I do that, I just want to say there was a comment for Tricia that basically said that someone else is saying the same thing about take up in a rideshare study where folks are reticent to take up the service at probation. They may not be seen as a trusted voice among study participants. So it's well worth discussing in your findings. And thanks for what you presented. But the next question, has anyone been able to explore the wrong wallet problem in their evaluation? The value gained from these multi-stakeholder efforts is usually disproportionately realized compared to who funds them, i.e. a city, town, county corrections program hires a health navigator with municipal funds. That municipality and community sees some decrease in cost or negative impact, but the managed care agency or hospital system or state via Medicaid sees savings over time without putting real cash into the program. Any thoughts on that?
This is a related answer, Linda. I mentioned the attribution where the 7 health plans, and it's the typical list, United Healthcare, Blue Cross, and so forth. They're all doing the job they need to do, but it results in a system of chaos. And the state Medicaid program is well aware of it, and we've been we have a lot of the data they need already to in fact we for that $300 million project developed our own attribution system, but it's only used for the purposes of the project. It's not used for the purposes of the health plans getting themselves on a common framework. That's the wrong wallet problem. We've talked with all of them. They say, yeah, you're right, that's a problem. Can't change it, won't change it. And but if Medicaid said you're going to change it, they would. Medicaid has told them before, everybody has to do something this way. You can't do it your own way. You all have to do it the same way. I mean, that's basic standardization. So that's a wrong wallet problem. Yes, it might be costly for them to each change it, but at the end of the day, the social benefit would be tremendous in terms of improving the health of the population. So the patients and the providers are connected. That's a wrong wallet issue.
Yeah.
Okay.
I think it kind of
Sure.
what went into my brain when I was reading that and listening to it was, the kind of diffusion of benefits is kind of the almost the opposite of that, maybe. Where you're doing something in area A and it spills over, the benefits spill into area B. And so for our system, the culture of health, getting people linked to care, because keep in mind that the people coming into probation are generally younger. And so like had we been able to be more successful in sustaining it, getting a system in place that would link some of those at-risk young people into healthcare young, there would have been diffusion of benefit across the area. So the wrong wallet piece, which kind of dovetails to what Trish was talking about, and what the one comment that was in there about the distrust is like, is this the right place to be reaching out to these populations? We went there, the original nugget that sent us to probation was this was a place where young, at-risk, non-connected people came on a regular basis. So, one of the conversations we had as we were kind of winding down was, what are the other places where these people gather? And can you do this kind of work in some other forums and reach out? And my hunch is that there's avenues there for success that we haven't had time to dig into. But yeah, getting that kind of thing in, because the benefit is there, definitely. And for the policing work that we're kind of starting up now, is kind of the dealing with the mental health things. The police, in some ways, like they don't mind, I don't think necessarily working with these agencies, even though it's kind of a wrong wallet thing. Why are we putting forth this effort? Because there's a boomerang effect where getting the person into the right kind of care means they quit showing up on the 911 incident calls, and so there's the diffusion kind of spreads over time, if that made any sense.
Okay. Emily and Georges, do you have any comments?
Yeah, I don't think it's something that we're going to intentionally be looking at in our study. I mean, I think it's something to be aware of. We may be kind of looking into it a little bit more closely now. I think similar to like Daniel was saying, like our program, they are so supportive of each other that if they see any success, they're going to all take credit for that success, regardless of if it was like their dollars or somebody else's dollars. I think they're just so invested in how this will impact their community and their individuals that they're willing to kind of, I don't want to say look beyond it. They're definitely aware of kind of the cost benefit approach, but that they'll be happy to see kind of any shifts in where the costs go.
Okay, that's great. So there's certainly a lot to think about in the context of all of these projects, and there's been some common findings that you have, but also some things that might vary a little bit from project to project. So if you were to give some advice on how to take what you've learned and move it forward, what would be maybe the single piece of something that you would tell someone who was going to try and apply the kind of work that you've done, the results of the work that you've done to their community to improve things? What would be the important things for them to consider?
I'll take a bite.
Okay.
I think what we've learned from this and from other projects and working with some of the people here and just like listening and learning from them is that there are a lot of people who are out there who want to make a difference, right? And they don't always know how. They don't know how, they don't have time. They're busy within their structure of what their current, everybody's putting out this week's fire. And I think it behooves us as researchers who have time to think about some of these things, explore literature, go to conferences, and do the things that some of these folks in the field can't, to kind of use projects like this to show folks, look, we know you want to make a difference and be innovative and do things differently. Here's a way of doing it, right? And maybe here's a little funding that can help you do it, that we're able to provide through, places like RWJF. And so what I would say to people that are starting out, like, okay, from the researcher side, there are people in the community who will work with you and who want to work with you, but they're probably not going to call you. You have to go out and call them and call these relationships because they're busy, right? And for people in the community, right, practitioners, there are researchers in your community. There's a local college, university, community college, whatever. There are people who think about this kind of stuff and can help, and who may be too busy to call you. So I guess kind of the thing is, communication and outreach, and make the phone call, ask for a meeting, and that's how all these things start. We talked about building partnerships. It all starts with an introduction and a hey, we'd be interested in talking to you about X, Y, or Z. And I find that when we do that, people respond to those things, and that's how all these projects start. And I think really in the end, that's how the needle slowly moves. So I'm not, yeah.
I think on the flip side of that too, as researchers, not really thinking about building connections with community partners, but also thinking about the individuals that we want to help, and how it's important for us to acknowledge our standpoint. And if we have no experience within the criminal justice system, I think we need to be honest about that, especially to our participants, that we are here to help, but we can't relate on that individual level, and we can learn so much from them. I feel like as researchers, educators, we all automatically think that like we know it all, right? That we've studied this, we've read these journals, we've read these publications, but we still have so much to learn. And I think it's best to ask, what are some needs that you have that we could help with? Because I know for our project in particular, and even our community partners, we're so interested in getting them to primary care physicians, because that could be the person then to kind of take hold and service out, which makes sense. But so many individuals it was dental and eye exams were like the #1 things that they wanted. And we went into that project like not even having resources for those right away, because we were thinking primary care. And so we spoke to them and said like, okay, well, we received primary care in prison or jail. We hardly got dental or eye exams, and this is what we want. So then we had to go back to Christiana Care and tour their dental and eye facilities, see what services we could talk to them about. So I think that's just a huge lesson, right? That we need to, if we're truly going to want to work with and help people, it needs to be like everyone at the same level. What could we do for you? How can we learn from you? We can't just think that we can just dump all of this knowledge and services onto them without asking what we could do for them, or what really is the need that they want us to help with.
Okay, great. Bill or Emily and Georges? Anybody?
Yeah, a lot of academicians I know are not shy about asking a community partner to provide services for free. And on the other hand, we get a lot of requests from the community for organizations for what Trish and Daniel just mentioned, that they need help. And whenever we always do it unless we absolutely can't. So it's pro bono, and we don't expect anything in return. But as often as not, it can lead to a funding opportunity. And so it's there's got to be a two-way street. It can't always be what's mine is mine and what yours is mine. It's got to be, let's make the pie bigger rather than trying to figure out how to divide the pie.
Okay, great. Georges and Emily?
We don't have much to add here from what the speakers have mentioned. Just two quick things, as Bill just added, you think about the long term, partnership and building towards, having a strong relationship and go through different events through that, timeline of the relationship, pro bono and, doing things like that could, build trust. And eventually, this will lead to, a successful partnership or successful funding. And I think another thing I want to mention is from a researcher's perspective, it's very rewarding to work with community and those who are on the ground and different stakeholders. Much more enjoyable than going to other academic conferences. But often you feel that you're making a difference, even if some of those outcomes, like Daniel mentioned, they were not as strong as you would hope or you anticipated. But at least you learned a lot. You documented, and you also brainstorm ideas for other opportunities and other potential partnerships.
Okay, great. Okay, and we don't have any other questions in the Q&A. Does anybody on the panel have anything else that they want to add or comment on before we close?
Nothing here.
Okay, so thanks everybody. Thanks to people who have joined the webinar and engaged in the question and answer session. And thank you to all of the panelists for everything that you've done and the work that you've been doing to work with the community and really try and create some alignment of these systems and work with partners in the community and help really engage people in the law enforcement area, criminal justice system. So thanks everyone for attending. And as I mentioned earlier, the slides and the recording of this will be online. You'll get the links emailed to you. And we really look forward to you participating in any future webinars. And thanks again to the panelists for all of the work that they've done to put this together.
Welcome.
Thanks
Thank
to
you.
RWJF for funding all of this. Thank you.
Okay.
Thanks, everybody. Take care.
Bye. Bye.
Bye.